And now I am very honored to introduce our final speaker for tonight, Saurabh Sinha, who's a member of the Robert Wood Johnson Medical School class of 2015. And now his bio is in the program, and I highly recommend that you read it. But on a more personal note, I met Saurabh my first month of medical school. He's the current third-year medical student of a student doctor team that I'm a part of at Promise Clinic. And Saurabh is one of those individuals who always seems to be extending a hand to help or an ear to listen to those of us who need advice on how to get through the first month of medical school or what third-year schedule to pick. And I know for me and for many other people that know him, Saurabh has always been seen as a mentor. And when I first heard his talk, I wasn't even remotely surprised that these characteristics of him carried through his talk. But what really blew me away was how much his talk inspired me to start examining the little aspects of the way I see and perform medicine. And I hope that it will do a little bit for that for you too. And so without further ado, please help me welcome Saurabh Sinha.
You are all time travelers. Allow me to explain. Imagine you're sitting on your couch, you got a book in your hand, and you're nice and comfortable. You know you got that big thing coming up, but you don't have to worry about it quite yet. You got some time. And so you, nice and relaxed, you reach over to the table next to you to grab something, and as you do so, you glance at the alarm clock that's sitting there, and oh my God, it's 6:57? What? No. Bleepity, bleep, bleep, bleep. I'm gonna be like 25 minutes late now, and do I even have my clothes ready? I mean, what does one even wear to this kind of thing? Etc., etc. All the stress and implications of it being 6:57 wash over you and flood down to the tips of your fingers, and wait a second. Daylight savings time ended yesterday, and you forgot to change that clock. So, you travel backwards through the very fabrics that stitch seconds together to arrive at 5:57, where everything is okay. You have time. And that pit in your stomach fills up, and everything's just peachy. And guess what? You just traveled 1 hour into the future and back. Look at you, all skydiving through the space-time continuum. You see, time is a construct. It's something we've created in our very human need to make sense of the world in which we live. But get this, we created it, yet we are entirely governed by it. Take me, for example. As a third-year medical student, I am rife with questions about the future. What field should I go into? How do residency applications work? Seriously, what field should I go into? But at the same time, I'm worried about the past as well. Did I do enough? Am I good enough? What is enough? And I think we all have a tendency to do that. There's always something in the back of our heads catapulting us into the future or backwards into the past. But you know what? Maybe what's really important is what's happening right now. Think about this. There's nothing else but right now. The present moment is the only moment there is. The past and the future exist but within our minds. The only thing that's real, tangible, is right now, this. And so, during the year, I've wondered, do I really have to wait till I become a doctor to help people? I mean, what can I do right now? I don't think we ask ourselves that question enough. What can you do right now? Well, come one, come all. And let me tell you a story. Let's travel back in time and listen to a story about how this past October, living in the moment changed my perspective on medicine entirely. I'm driving, dark and early at 5 a.m. to the Children's Hospital on my pediatrics rotation. I meet up with the peds team for morning sign-outs, and just so you know, it's a big team, though not everyone's there yet. We have 4 medical students, 5 interns, a couple senior residents, an attending physician, and a partridge in a pear tree, all coming together for patient care. And so I pick up a patient of my own to follow, and he's a 16-year-old kid. He has severe traumatic brain injury following a bicycle accident almost 5 months ago. He's dependent on a feeding tube that goes into his stomach, and it's fallen out multiple times in the past week. His mom is pissed. I mean, she's tried to get it fixed, and it keeps falling back out. And so I confirmed that he's scheduled for a procedure for the afternoon to get a new one put back in, and I walked down to his room. And first impressions, he looks like he's in a bad way. I mean, he's got multiple tubes coming in and out of him. He's breathing with a face mask, and his body is just really rigid. And it's unfortunate. I mean, 16 years old, he's a pretty big kid, looks like he could have been a high school football star, but here he is, and he's one of the sicker patients I've seen thus far. And then I see Mom sleeping in a little built-in bed between the windows in the back. And being 6:30 in the morning, I have to go wake her up. Hey, good morning. My name is Saurabh Sinha. I'm a third-year medical student on the team. Just wanted to talk. Barely gotten those words out of my mouth, and she goes off. Why is this not getting resolved? He's supposed to be in rehab right now, making progress, and everything is messed up. What are you going to do? Standing timidly a few feet away, I wonder to myself, when is she going to remember that I said, I'm a medical student? I am powerless here. I mean, I'm not a doctor. I can't place a feeding tube. I mean, I can't do anything. I can't do anything. I can't do anything. I can't do anything. But here's the moment that I ask myself, what can I do right now? And I realize I can just listen to her. I can just shut up, forget about what I can't do, and focus on what's happening right here. And so I do, and she vents until she gets it off her chest, and I wonder to myself, when was the last time anyone really listened to her about this? And then I tell her what I know, that her son is scheduled for a procedure, and we're going to be following with her very closely to make sure it happens. And she says, thank you for actually listening to me. And I feel the worries of what do I know slipping away, and I start wading in the waters of, well, I'm here. And I realize that something deeply nuanced is going on here. This isn't just an angry person. This is a mother and her son. And despite the fact that her son can't speak because of the injury, outside of these low rumbling grunts, she's able to pick up on all of his little signals. He clenches his fist ever so slowly. And Mom says it means he's upset. But she gives him gentle kisses on his forehead, and it calms him down. And it's beautiful in the way that only a mother's love can be. And so I finish up, and I meet up with my team for morning rounds, and I present my patient like any other patient. And we go down the list, meet up with all the other patients, and finish rounds, right? But something feels incomplete. Nowhere in my presentation did I mention the clenching of his fist or that unspoken understanding of Mom. And all at once I realize I have barely scratched the surface. I mean, this is my patient. What can I do right now? And so I walk back into his room, and I sit down on a little box next to Mom, and I say, tell me all about your son. Tell me everything. Who was he before all this? And she pulls out her phone and starts showing me pictures. You know what? I was right. He's played football all his life. We travel back in time to when he was a little 5-year-old playing pee-wee football. And you know what? He looks exactly the same. Mom says he has the same big head. And then we hop forward in time to him in high school in his high school football uniform, standing there with his best friend, Mr. Popular, Mr. Class Clown, all rolled into one. Family shots, cousins, meaningful relationships, all flying before my eyes with the swipe of her finger. And all the while, I see a mother's love resting deep in her eyes. And then I really ask her, what happened to your son on that day almost 5 months ago? And the entire gut-wrenching timeline is revealed to me. A teenage boy is at grandma's just a few blocks away from home. He kisses grandma goodbye, hops on his bike. A few minutes pass, some more, not home yet. A few blocks away, a mother starts worrying, as mothers are wont to do, but she tries to calm herself down. Don't be crazy, don't be crazy. But meanwhile, a few streets over, a teenage boy is bombing down a hill, picking up speed as teenagers are wont to do. But as he gets to the bottom, he loses control, and his back tire hits a car parked on the side of the road, and he goes flying into the air and smack! Hits the pavement with the back of his head, helmetless. Blocks away again, a mother is now really starting to worry. It's been a while, why hasn't he called? This is so unlike him, and it's all beginning to feel quite strange. But swing back again a couple blocks over, and there are now flashing lights and sirens so close that she can hear them. And a teenage boy is in an ambulance being rushed to the hospital. A mother is now pacing around her home. No response from her son for over an hour, and she's called grandma, she's called all his friends, and no one knows where he is. And now she's starting to think that maybe those sirens that she heard, maybe that was him. But no, stop thinking that. Don't think that. But why hasn't he called? Why hasn't he called? Why hasn't he called? And she gets a call from his phone, but it's not his voice. Is this a relative of the person who owns this phone? Yes, this is his mother. What's wrong? Where's my baby? What happened? You need to come to the trauma center immediately. Your son has been in a serious accident. There I am, sitting on my box, traveling through time with this woman who has been through so much, with her son behind me. My God, I had no idea. We talk about how the past 5 months have been, how it's been hard, how sometimes she cries herself to sleep at night. But she tries to be strong, and in spite of it all, they're making progress with the grace of God. We talk for a while longer, and I give her as big of a hug as I can muster, and as I turn to leave, I look at her son through an entirely different lens. I glance up at the clock and I realize I've not only missed lunch, but a couple of lectures as well. Yet, that hardly seems significant in the face of what I've just learned about my patient. And so, I eventually go home, but I have trouble sleeping because I can't stop thinking about them. And so I come back in the next morning, and Mom and I greet with a hug. The feeding tube got replaced, and it's working, and everything's going fine. We high-five about the news, and I do my physical exam, and everything is going well. And so I meet up with my team again for morning rounds, and I present my patient again. But as I do so, I feel the gravity of his story weighing down on every part of me, and I want the team to be present with me, to truly realize that this isn't the patient that we just came from or the next one on the list, but an individual right now, a person with a story that matters in this moment. And so, with the team standing in our white coats holding folded sheets of paper, I share that story. Everything. And there we are, riding on his bicycle together, as passengers in the ambulance together, standing in the trauma bay with his mother, holding our breath. And then we walk into his room, and I say, "Hey, Mom, I told the team about him. Could you show us those pictures?" And there we are, all 13 of us, standing in a semicircle around his bed, traveling through the timeline of his life together. I freeze frame. I count. 4 medical students, 5 interns, 2 senior residents, an attending physician stopped for a moment, and despite the fact that we have lab values to check and CT scans to order, we are entirely present. And I look at Mom, and she's happy. She's laughing as she tells stories about her big-headed little baby, and despite the fact that her story is lingering in the air and there's this uncertainty about the future, she is entirely present. And I think that all of this arising is like grass peeking through cracks in a concrete sidewalk. And here we all are, bearing witness to this most profound improbability. On an October morning, I realized that I can do something. We can all do something, and it starts with being present. So, where are you on your timeline? Is there something in the future that's dragging you away from right now? Or are you weighed down by the regret of something in the past? Well, let me tell you this. It's never too late to start living in the now. In fact, the power is entirely yours. To the first and second year medical students who are here, that page that you're studying, sink your teeth into it. Every graph, every little detail is part of the bigger picture. So be entirely present in your studying. Ask questions, delve deeper, learn for the sake of learning, because you never know how that thing you find out may change your view of the world entirely, or there might be the chance that years down the line, you may find it again, sitting by your patient's bedside, waiting for you to recognize it. To the third and fourth years here, you have the potential to know your patient better than anyone else on the team. So, learn their stories well. Be entirely present. Because who knows how the patient sitting in front of you could change your perspective of medicine entirely. And to the residents and attending physicians who are here, you've taught us that every patient may be going through the most trying times of their lives. So, don't forget to take a second to live in your patient's present. And remember that a few simple words from you could change the course of things in their minds entirely. Our lives are but a flash in time. They're built of moments in time. They're flashes in a grander fireworks show. A 16-year-old boy's life can change in a split second just blocks away from home. And a mother's perception of the health care her son is receiving can change because of the efforts of someone who dares to push the boundaries of right now. So, what time is it on your alarm clock? Are you an hour ahead? Years ahead? Years behind? The future and all its limitless possibilities arise right now. The past and all the perspectives that you can change exist right now. All of the difference that we can make in the world starts right now. So, fellow time travelers, I ask, where are you? Thank you.